disease of the eye caused by an infection with the bacterium trachomitis. It's transmitted through personal contact or flies, as I've already mentioned. 41 counties have been affected. Actually, it's 41 countries affected, including Kenya. And then let's take a look at the effects of this disease. It has irreversible blindness, visual impairment, and 1.9 million people are affected globally. Now, let me take you through some of the counties that are affected by this deadly disease, and they include Turkana, West Pokot, Baringo, Samburu, Laikipia, Meru, Wajir in northern Kenya, as well as Marsabit, Narok, Kajiado, and Kitui. Over to yet a report that is touching health in this country. This morning, a section of workers at the Kenyatta National Referral Hospital downed their tools, demanding a back to the year 2015. Here are some of the grievances, and I'll be speaking to the Kenyan National Union of Nurses, Seth Panyanko, shortly on the services that will be disrupted in this strike. Let's listen in first.
Employer, you do admit it is a fact that the Kenyan enjoys 2 job group higher than the minister, and you confirm and say yes, it is a fact. Then our question then is, what then have you been doing? And you say they used to enjoy 2 job group higher, but they do no longer enjoy. Under common law, if today I'm giving my sister a cup of milk for 15 good years, I go without a notice. That one is termed as a common law. And we have asked if the workers of this institution enjoyed 2 job group higher, they do no longer enjoy. It is very simple. Give us the circular that withdrew the privilege, if at all you say it was a privilege. It was not given out. Meaning we are still 2 job group higher. And we will move more and more. As I have said today, we have a lot of things to say, but please let me rely only on the 4 items. Yes.
Of course, those are just some of the disgruntled workers there from the KNH, the Referral Hospital in Kenya. The hospital has about 5,000 staff, 4,700 of them are under Kudeya, and the nurses union have about 1,400 nurses in that institution. Now in studio once again I have Seth Panyanko, who is the nurses union secretary general. Good afternoon, Seth.
Good afternoon.
To the program.
Thank you.
First of all, let's just begin with this. What is the bone of contention? Is it just about allowances or the whole enumeration setup?
First, I want to make something very clear, that the nurses union is not on strike at Kenyatta National Hospital. Basically, people are on strike as support staff.
Yes.
The doctors union is not on strike, and the nurses union is not on strike.
So nurses are working?
The nurses are working.
Yes.
They have not been instructed by my office to go on strike. But notwithstanding that, we are not trying to say that the grievances being advanced by the Kudeya union are not valid. The issues are valid because these are a directive that advice that were given by SRC in 2015 that Kenyatta National Hospital employees deserve to be paid those allowances the way they're supposed to be paid. But now serious grievances that they want to tackle to the government, they will soon be announcing their own strike. We want Kudeya first to finish their strike, and then nurses will follow their own strike because they joined this union about 4 years ago. But up to now, Kenyatta National Hospital management has refused to deduct union dues and has refused to sign a recognition agreement with the union so that the union can represent effectively their members.
So the nurses and doctors are working at the moment. It's good to put that clear out there.
Yeah.
So up until now, even the supporting staff, they're equally very important. There are about 4,700 of them under Kudeya.
Yes.
So has the institution, that is Kenyatta National Hospital, made any communication so far since morning?
First, I want to say that we are not trying to say, I've said from the beginning that we recognize and support the issues being raised by Kudeya because as long as our work is going to benefit, even if it's not our work that I represent, I cannot say the strike is null and void. They have genuine grievances and they have legitimate issues that must be addressed by the Kenyatta National Hospital Board. I can tell you clearly that as much as nurses and doctors are not working, without those support staff, there's not much that can go on in a hospital. Because when you want, for example, you want to work in a ward, you need a ward that is clean.
Yes.
You need somebody to help you ferry patients from one place to another place. You need equipment. You need to send people to do certain things. You need, even you're discharging a patient, you cannot discharge a patient if the bills have not been cleared.
So it will have an effect on the operations
as
of the
as if,
hospital.
in fact, what is happening is that nurses are just at the workstations, but there's not much they can do because the people who support them, that's why they are called support staff.
Yes.
The people who do the much of the work are not working. Because when you look at admission, for example, how will you admit a patient when bills have not been paid? How will you even bring that patient to the ward when things which are supposed to be done by support staff have not been done? It's a crucial is an issue of maybe the issue of bills. If you have been discharged yesterday, for example, you're supposed to go home today, I can assure you will not go. Because the people who are in charge of the bills are the ones on strike. So basically the operations are...
Yeah, of course, you've already mentioned the importance of this support staff there in the thousands in that hospital. So up until this moment, are you aware of any communication that has been made by Kenyatta National Hospital? And, are they doing anything to resolve the current situation?
I have seen the acting director trying to address the workers, but a solution has not been found.
Yes.
But as much as we are talking about National Hospital, there is a serious problem in the entire healthcare system in Kenya. Today, as we are talking, even Bomet, you are aware, they have just stormed the governor's office. They have not been paid salary for June. They have not been paid salary. Afadhali Kenyatta, they are talking about allowances. But
those who are not even getting
those who have
salaries.
not even getting the salaries. Bomet, they are not getting the salary for June. They have not gotten salary for July. The same applies to Nyamira. They have not gotten salary for June. They have not gotten salary for July. Nothing is going on in Nyamira, and nothing will go on in Bomet beginning today. And I can tell you, out of 47 county governments, about 5 only have paid salary for July.
Among the 47.
Among the 47.
So the natural question is this. These are things that can be avoided because county governments get their funding from the national government on a yearly basis. So what does this say about the seriousness of this county government with regards to health?
We remember in 2012, 2013, these are the issues we're talking about. We say county governments were not ready. They were ill prepared to take over a healthcare system. But because of our political system in this country, where people see their political clout, they want to control health, they believe health has a lot of money, they actually devolve health as a function without following the provision of the Constitution.
Now it's devolved.
These are the repercussions.
Yes, I think now it's devolved.
It's now devolved.
It's water under the bridge. Are you confident in saying that there's progress that is being made? Is there any progress whatsoever?
I don't think so. We have problems. Like right now, we are talking about 42 county governments that have not paid salaries for July. The 47 county governments that have not released statutory deductions from the month of June. Some far as January. They have not paid statutory deductions. So if you fall sick today and you are a health worker and you go to a hospital, you will not be treated because NHIF has not been have not been paid. You have loans which are not being serviced. We as a trade union, we are also an employer. We have workers who have not been paid salary because we did not receive our money for June and even July. So what we are saying, we wanted this issue of remuneration to be ring-fenced so that it is not, when the money goes to the county governments, is the recurrent account should not be considered as development money. And we have problem push and back between the national government and the county government. And this is affecting workers. Why should someone go on strike because of salary that someone worked for?
And then, interestingly, universal healthcare is one of the big 4 agendas of the current administration. Nurses are not being paid. Doctors have their own problems. We remember the other strike that they had, which ran into months. We're not seeing medicines in most hospitals. One of being Nairobi, most hospitals don't have the required medicine. Where will this leave? One of these big agendas by the current administration. Where will it leave universal healthcare?
From the beginning, as a union, we have always supported universal healthcare coverage. But the reality is that the way the structures and systems are being put in place, the key stakeholders are not being involved. For example, I'm heading one of the most strongest union in terms of health sector. I'm not aware what they are doing in universal health care. We are not part and parcel of what's going on. So we don't know what's going on. How to talk of universal health care when health workers are out in Kenyatta demanding something that was approved in 2015? How do you talk of universal health coverage when the people are supposed to give that health care services like in Nyamira and Bomet have not been paid salary for 2 months? When we are talking about the entire 42 county governments who have not paid July salary, when they are not remitting statutory deductions, when the same people who are giving that service cannot access that service because NHIF has not been paid.
Yes.
So we cannot talk of universal health care coverage, which is going to be offered by healthcare workers who cannot access the health services themselves. So we believe that the government is missing out in terms of involving key stakeholders in these things. Even when we saw the equipment scheme was being launched by the president, if you can remember, the people who were there were Kenya Medical Training College students. We were not there. Today they are talking about coverage, healthcare coverage, which we support as a union. But we don't know. We have never been invited in any meeting. We are not involved. Because the government first must begin by saying, what can we can motivate healthcare workers so that the only function left there is for them to deliver services. We are still talking about salaries not paid for July. We are talking about statutory deductions not remitted from some of the counties from January. Yes. How they do talk of universal health coverage? Today we are talking about drugs of about 4 billion, which are being withheld at the Jomo Kenyatta International Airport. And yet we have Kenyans, we have patients who are suffering from trachoma. We have a government. I don't know what's happening. But what we need is the office of the president, maybe to establish a department to engage key stakeholders in health for us to tell them where the problem is. Where is healthcare system ailing? Because we are the shoe wearers and we know where it pinches.
And of course, the workers are a very important component when it comes to the implementation of the universal healthcare. One final question. Let me take you back to the Kenyatta National Hospital. The strike is on. You've already mentioned that nurses and doctors are not part of it, but of course you support their call for allowances and all this. Your message to KNH at the moment, is it something they could have resolved?
I want to tell the Kenyatta National Hospital that to stop hiding and trying to shift goalposts. What we know is that allowances were issued in 2015 and they should pay. And they should not also wait for nurses to go on strike, because nurses are going to strike in the Kenyatta National Hospital in the next few days because their right to belong to a trade union of their choice has been denied. As when they resolve the issue of Kudeia, nurses will also be going on strike. They should not look at those support staff who are out and say, oh, because doctors are working and nurses are working, these people don't mean anything. If they don't mean anything, why do you have them in that hospital? Because nothing can go on without support. You cannot even conduct a surgery in theater because the theater assistants are on strike. Theater assistants are on strike, theater anesthetists are on strike. Everybody else who is not a member of the union, the nurses union and the doctors union, is on strike, including clinical officers. In fact, the guy you saw speaking is a medical apparel person. So all these people are the people that constitute a healthcare system. Healthcare is a system. It is not something for doctors or for nurses. So one component of that healthcare system is affected, the entire system is affected.
Thank you very much, Seth Manyanko, for your input. He's the Nurses Union Secretary General, talking us through that strike that we've seen taking place from early this morning at the Kenyatta National Hospital. Of course, that's a story that we're still following for you right on KTN News. But over to some heartwarming story, a gesture by the young to the old. A group of youths from Embu County have been donating blankets to elderly persons there, residing in the villages close to Mount Kenya Forest and who are hard hit by the ongoing cold weather. The group a Visionaries family comprises of young business persons within Embu town. They say they are aware of the general neglect of senior citizens and want their kind gesture to be replaced or replicated by other youths across the country.
Hii mali yetu iko karibu na msitu. Msitu imefungwa na serikali. Mabibi zetu wale wasee hawana kuni ya kupiga naye, makani bei ghali. Huyu mzee blanketi anatufanya vizuri sana. Anatuletea blanketi leo. Tutarara vizuri. Tunamuombea Mungu amubariki.
Na tumekuja kwa hoja moja tu, kuja kusaidia watu wazee ambao hawajiwezi ili wapate blanketi na wapate kitu ya kuwapea joto. Huku temperature yenye ilikuwa 10 days ago ilikuwa less than 10 degrees Celsius. Na kulikuwa na baridi mingi sana. Watu walikuwa wanapata shida hata upati usingizi. Lakini niliona ya kwamba ni vizuri hata mimi na uwezo wangu niweze kushikana na marafiki zangu na niweze kununua blanketi ambazo zitakuja kuwasaidia. Na hii ni mojawapo ya project ambazo mimi naona zinafaa kufanywa na vijana kama mimi ambao wameendelea na wakaweza kusaidika kutoka kwa hii society, that is giving back to the society.
Aid for the Aged, a very positive initiative. Then that report takes News Desk to a very short break. But when we come back, you can see Robinson Kenya is ready in studio and he has all the latest from the entertaining world of sports. Stay tuned for that.